a lot of choices in healthcare are made based on word of mouth. And what we need to do is be able to provide an outstanding experience for patients who come here and have them out there talking about it. And we've seen a lot of that. You know, I think everything we do has to be patient-focused and patient-centered. I think in the past we've paid a lot of attention to how we treat the medical staff and providing an educational setting for training physicians of the future, medical students as well. And the focus has not really been on the patient. And I think, you think about it for a second. I mean, you come into the hospital at a time when you're most vulnerable and you get put in a semi-private room with a stranger. Can you imagine checking into a hotel when they say, here's who your roommate will be? Is it reasonable to have somebody sit down in radiology for 2 hours waiting for a procedure when they could be in their, in the bed upstairs, coming in for an operation, telling you to be here at 6 in the morning and not getting to you till 2 in the afternoon? We've not done a very good job of respecting, number one, people's dignity, but also respecting their time. Simple things like having some respect for people's dignity and their time are the very basics of customer service. It's not that much more of a leap to give people a choice as to what they eat, even within some sort of restriction that they may have for their dietary needs. Hospitals have not exactly been great about common courtesy, just treating people with respect. Those are areas we just really haven't paid any attention to in the past, or much attention to, and that are just critical now. And patient satisfaction scores will be a determinant of a piece of reimbursement. How you're treated, what's the overall patient experience is what we're concentrating on. And what falls on me as the CEO is to create an environment where people can be successful in what they're doing and can reach their full potential. And creating that environment where they can be successful ultimately translates into outstanding care of the patient. But it all comes down to educating the staff. We've worked very closely with the staff in educating the staff, and part of this is an education piece. We have put into place on the outpatient side a significant number of individuals who work with the practice to facilitate how patients are seen. But a lot of it's just educating the staff as to how to treat people. And we have some patient navigators now to be able to guide patients along the way. We also are looking at that as a transition from inpatient to the outpatient setting and the home as well. I don't think there's any question that medical care is going to be moving closer to the home, and in fact moving into the home. The hospital no longer really is the center of the universe, and much of what we do is done as an outpatient. And the logical extension of that is, what can we do in the home? And especially with the use of technology, I think we will be able to do more and more in the home. So we need to be nimble enough to recognize that inpatient business is not going to be the be-all and end-all of what we do, and we need to be looking at some alternatives. And for that, we have we've put the Temple T out in the community, both from the urgent care standpoint as well as additional outpatient settings, and that's a part of our overall strategy. And places where we've gone, we've been very successful even in the short run.